Are you living with the persistent pain, debilitating fatigue, and restless nights of fibromyalgia? A new treatment, Tonmya, is emerging as a potential game-changer, offering hope for significant relief. Tonmya, with the generic name Cyclobenzaprine, is a new non-opioid prescription treatment. It's specifically designed for adults with fibromyalgia. This medication aims to reduce pain, improve sleep quality, and alleviate fatigue. It's taken once daily at bedtime. Clinical trials have shown that Tonmya can decrease fibromyalgia pain as early as the first week of treatment. Patients often experience continued improvements over time. Tonmya, Cyclobenzaprine HCL, is a sublingual tablet. This means it dissolves under the tongue. This unique delivery method allows for rapid and long-lasting pain relief. The FDA granted approval for Tonmya on August 15, 2025. It's approved as a first-line treatment for adults with fibromyalgia. This approval was based on robust clinical trial data. The Relief, NCT 04172831, and Resilient, NCT 05273749, trials demonstrated significant reductions in pain and improvements in sleep at 14 weeks. Substantial pain reduction was achieved as early as week 1. Improvements continued throughout the Resilient study. Tonmya is thought to work by its potent binding and antagonist activities. It targets 4 different postsynaptic neuroreceptor subtypes. These include serotonergic 5-HT2A, adrenergic alpha-1, histaminergic H1, and muscarinic M1 cholinergic receptors. The sublingual formulation of cyclobenzaprine offers distinct advantages. It enables rapid absorption directly into the bloodstream. This bypasses the first-pass hepatic metabolism. This bypass reduces the formation of norcyclobenzaprine. Norcyclobenzaprine is a long half-life active metabolite. By reducing its formation, Tonmya may offer improved tolerability for patients. Tonmya is a sublingual tablet. It is taken once daily at bedtime. The tablet or tablets should be placed under the tongue and allowed to dissolve completely. Proper administration is key for effectiveness and to minimize side effects. First, administer Tonmya after brushing your teeth and completing other oral care. Ensure your mouth and the sublingual area are moist by drinking a few sips of water beforehand. Place the sublingual tablets under your tongue. Allow them to dissolve fully. Do not swallow the tablet whole, cut it, crush it, or chew it. After the tablets have completely dissolved, do not eat or drink for at least 15 minutes. You should also try to avoid any hot, cold, or acidic beverages until the morning. Additionally, avoid talking for at least 5 minutes after administering the tablets. The recommended starting dose of Tonmya is 1 sublingual tablet, 2.8 mg, once daily at bedtime. This initial dose is for the first 2 weeks of treatment. After the initial 2 weeks, the recommended maintenance dose is 2 sublingual tablets, 5.6 mg, once daily at bedtime. The maximum recommended dose is 5.6 mg once daily. For geriatric patients and those with mild hepatic impairment, the recommended maximum dose is 2.8 mg, 1 sublingual tablet, once daily at bedtime. Tonmya is not recommended for patients with moderate or severe hepatic impairment. If you miss a dose, take the next dose at the regularly scheduled time the following evening. Do not take 2 doses to make up for a missed dose. Like all medications, Tonmya can cause side effects. It's crucial to be aware of these and discuss any concerns with your healthcare provider. Common Tonmya side effects include oral pain, fatigue, and dry mouth. You might also experience numbness in the mouth, oral hypoesthesia, oral discomfort, or an abnormal product taste. Drowsiness, canker sores, and mouth tingling, pricking, or burning are also commonly reported. Tonmya may also have serious side effects. You should tell your healthcare provider right away if you experience symptoms of a serious allergic reaction. These include difficulty breathing, hives, swelling of the face or tongue, or itching. Embryo-fetal toxicity is a serious concern. Based on animal data, if Tonmya is used 2 weeks before conception and through the first trimester of pregnancy, it may cause neural tube defects. Females of reproductive potential should be advised of this potential risk. They should use effective contraception during treatment and for 2 weeks after the final dose. Serotonin syndrome is a potentially life-threatening condition. It has been reported with cyclobenzaprine when used in combination with other drugs. These include selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, TCAs, tramadol, bupropion, meperidine, verapamil, or MAO inhibitors. Tricyclic antidepressant-like adverse reactions can occur. TCAs have been reported to produce arrhythmias, sinus tachycardia, and prolongation of conduction time. This can lead to myocardial infarction and stroke. Patients should stop taking Tonmya and notify their healthcare provider immediately if they experience symptoms of arrhythmias or tachycardia. TCAs can also lower the seizure threshold and are associated with serious CNS reactions. If clinically significant CNS symptoms develop, your doctor may consider discontinuing Tonmya. Atropine-like adverse reactions are also possible. This medicine should be used with caution in patients with a history of urinary retention, angle closure glaucoma, or increased intraocular pressure. Caution is also advised for patients taking anticholinergic medications. CNS depression and risk of operating a motor vehicle or hazardous machinery are important considerations. Patients using Tonmya should not operate a motor vehicle or other dangerous machinery. This applies until they are reasonably certain that Tonmya will not affect their ability to engage in such activities safely. Oral mucosal adverse reactions may occur. Tonmya may cause severe oral side effects. Patients should moisten their mouth with sips of water before administration to reduce the risk of oral sensory changes, hypoesthesia. Report any severe oral side effects to your healthcare provider. This is not a complete list of all possible side effects. Always call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088. Tonmya may enhance the impairment effects of alcohol. These effects may also be seen if Tonmya is taken with other CNS depressants. Avoid or limit the use of alcohol and other sedating medicines while on Tonmya. As mentioned, patients should not operate a motor vehicle or other dangerous machinery. This applies until they are reasonably certain that Tonmya therapy will not adversely affect their ability to engage in such activities. You should not take Tonmya if you are allergic to the active ingredient cyclobenzaprine or any inactive ingredients. It is also contraindicated if you are taking monoamine oxidase, MAO, inhibitors or within 14 days after their discontinuation. Tonmya should not be used during the acute recovery phase of myocardial infarction, heart attack. It is also contraindicated in patients with arrhythmias, heart block or conduction disturbances, or congestive heart failure. Patients with hyperthyroidism, overactive thyroid, should also not take Tonmya. Before taking Tonmya, tell your doctor if you have liver impairment. Tonmya is not recommended for patients with moderate or severe liver impairment. Regarding pregnancy, Tonmya may cause neural tube defects. This risk applies when used 2 weeks before conception and through the first trimester of pregnancy. Neural tube development occurs early, often before pregnancy is recognized. Females of reproductive potential should be aware of this risk. They should avoid Tonmya 2 weeks prior to conception and through the first trimester. Effective contraception is advised during treatment and for 2 weeks after the final dose. A pregnancy test may be required before starting this medicine. If you are breastfeeding or plan to breastfeed, tell your healthcare provider. It is not known whether cyclobenzaprine passes into breast milk. Discuss the best way to feed your baby with your healthcare provider while using this medicine. Many drugs can interact with Tonmya. Always tell your doctor about all your other medicines. This includes prescription and over-the-counter medicines, vitamins, and herbal products. Life-threatening interactions may occur with MAO inhibitors. Avoid concurrent use. Serotonin syndrome has been reported when Tonmya is used with other serotonergic drugs. These include SSRIs, SNRIs, TCAs, tramadol, bupropion, meperidine, verapamil, or MAO inhibitors. Symptoms may include mental status changes, e.g., confusion, agitation, hallucinations, autonomic instability, e.g., sweating, rapid heart rate, labile blood pressure, hyperthermia, neuromuscular abnormalities, e.g., tremor, ataxia, hyperreflexia, clonus, muscle rigidity, and/or gastrointestinal symptoms, e.g., nausea, vomiting, diarrhea. The CNS depressant effects of alcohol, barbiturates, and other CNS depressants may be enhanced when taken with Tonmya. The risk of seizures may be enhanced if Tonmya is taken with tramadol. The antihypertensive effect of guanethidine may be blocked by Tonmya. This is not an exhaustive list of all possible interactions. Always consult your healthcare provider or pharmacist for a detailed interaction report. Store Tonmya at room temperature, between 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. Store and dispense it in its original container. Protect it from moisture. Upon first use, remove the polyester coil and discard it. Keep the desiccant canister in the bottle for the entire period of use. The active ingredient in Tonmya is cyclobenzaprine hydrochloride. Inactive ingredients include colloidal silicon dioxide, corn starch, crospovidone, type A, DNC yellow number 10, dibasic potassium phosphate, mannitol, and sodium stearyl fumarate. Does cyclobenzaprine make you sleepy? Yes, cyclobenzaprine can make you very sleepy. This side effect may worsen with higher doses. Drowsiness is the most commonly reported side effect, occurring in up to 38% of people in studies. Fatigue and dizziness may also occur. Avoid or limit alcohol and other sedating medicines. Also, avoid driving or operating machinery until you know how Tonmya affects you. How long does it take for Tonmya to work? Immediate-release cyclobenzaprine tablets typically start relieving muscle spasm pain in about 30 to 60 minutes. The full therapeutic effect may take up to 7 days. Is cyclobenzaprine a controlled substance or addictive? No, cyclobenzaprine is not classified as a controlled substance by the DEA. It does not have physical addictive or abuse properties like opioids or benzodiazepines. It is not an opioid. However, some patients may feel psychologically dependent or experience withdrawal symptoms upon discontinuation. Tonmya represents a significant step forward in managing fibromyalgia symptoms. Its unique sublingual delivery and targeted action offer a new avenue for relief from pain, fatigue, and sleep disturbances. If you are living with fibromyalgia, discuss Tonmya with your healthcare provider. They can determine if this new treatment option is right for you. Visit the official Tonmya website for more detailed information. Subscribe to our channel for ongoing updates on fibromyalgia management and new treatment breakthroughs.